everyone, I'm Jan Marini, the founder of Jan Marini Skin Research. I am here with Claire, and Claire is a hairstylist, and she's here for her consultation. Claire, if there was something you could change or improve about your skin, what would it be?
My skin gets really dry, prone to dryness.
Okay.
I have some hyperpigmentation from being out in the sun, so especially, part of it's freckles that come out when I'm out in the sun again more. Anti-aging.
Okay. So preventative?
Yes, preventative.
Anything else you can think of?
Just like all over, even like dewiness, I like that too.
Any issues with acne, anything like that?
No, I'm really lucky. I don't get too much of that.
Okay. So you did say you were dry. So you would categorize your skin. If you were to categorize it, you would say you have dry skin?
Yes.
Okay. You don't get shiny anywhere?
No.
Okay. Have you ever been a smoker?
No.
Sunbather?
Unintentional. I swam my whole life, so.
Oh, okay. So you had a lot of incidental sun exposure,
yes,
or a lot of direct sun exposure.
Yes.
And did you put a sunscreen on when you were growing up?
Yeah, I still wear sunscreen on my face every day underneath my makeup.
Okay, good. But were you a swimmer mainly as like a child and a teenager?
Yeah.
So tell me, what do you wash with in the morning?
In the morning, I usually don't wash my face. I just rinse it.
Okay.
Because I get so dry. I put on whatever, like lotion or something at night. So I'm lucky my skin doesn't break out too much. So I usually just like rinse it off.
And then what do you do after you rinse your face?
I put on my sunscreen that I wear underneath my makeup.
Okay.
And then I put on like a makeup primer.
So no moisturizer or anything, toners, anything like that?
No, I'll do just my primer is like moisturizing. So I'll mix my makeup primer with my sunscreen and put that.
Okay, so you do. Okay, so you mix it mixed with a primer.
Yeah, that's moisturizing.
Okay, and do you know the brand of your? Do you remember the brand of your sunscreen?
Yes, it is SkinCeuticals.
Okay. Is it the physical blog?
I think so.
And so it kind of has a whitish look to it, a little bit of
this one's
a little bit of a tint.
This one's a tint,
so that it doesn't look white.
Yes.
Okay. And do you remember what the SPF is? I think it's like a 45.
Yeah, I think so.
Okay. And then at night, what do you do?
That's a great question.
Do you wash?
I wash my face. I take all my makeup off. I wash my face.
And what do you take it off with something and wash with something, or do you just wash?
Basically? I just wash it with like a makeup removing cleanser.
Okay. Do you remember the brand?
It's the Drunk Elephant one.
Okay. Drunk Elephant. I like that name. Is it a gel?
It's a gel.
It's a gel. So
yeah.
If you were to look at a skin type designation on it, is it typically say like all skin types?
I think so.
So just so everybody knows, generally a gel is going to be all skin types or combination. A lotion would be more normal to dry, and if it's a cream, it's usually something for dry skin. And what do you do after that?
Then I do, sometimes I have like it's all Drunk Elephant stuff. I got like one of those like little mini tester things. And it's, I have an eye cream that I'll sometimes do.
Any moisturizer?
Yeah. And then they have the Marjuka oil, like face oil. And then a moisturizer. It's pretty thick.
Okay, and this is all Drunk Elephant?
Yes.
Now, in terms of the moisturizer, does it have anything that it points to in it? Like, does it say it has a glycolic acid? It has peptides? Does it have anything in particular?
I think it has peptides. I know it's not glycolic because it has that little sample kit came with a separate like dropper with glycolic in it.
Okay. Did you ever use the glycolic?
Sometimes.
Okay. And
when I'm feeling festive.
We all know the glycolic is just for holidays. So when you were using the glycolic acid, how did your skin feel, or did you notice anything with that?
I definitely feel like it gets a little bit more dewy kind of looking.
Okay. Is there a reason why you didn't use it all the time, or?
I get worried I'm going to get sometimes, because I've done some other stuff where I've gotten dried out, so I don't try not to do it all the time.
What do you think makes your skin more dry? What are some of the things you've done in the past?
I did retinol or Retin-A.
Retin-A, prescription Retin-A?
No, not prescription.
Okay, so retinol.
And that dried me out.
Do you remember the brand?
It's not SkinCeuticals. It's, I can picture the container. I can't picture the name of it. But it was something from, it wasn't...
something from more of a physician's office?
Yeah,
it was... Spa? Okay.
Yeah.
Okay, so like a SkinCeutical brand.
Yeah.
And anything else you can think of that would dry your skin out?
For me, just honestly, like being outside or being out, like now when I go out in the sun or anything like that, my skin starts to feel dry again.
Okay, well, let's see. Where should we begin? Well, first of all...
Or overly, like, strong cleansers.
Okay,
if I use...
overly strong cleansers.
Yeah.
So give an example of a cleanser that you think might dry you out.
Like what my boyfriend has in his shower. Whatever Neutrogena, something that he has in his shower.
Okay.
I used it one time. I was like, note to self. Because I did put lotion on like right after and I was like doing stuff around the house and I could just feel my skin was like so tight. Well,
Neutrogena is actually a pretty good product, and it's got glycerin in it. But whether you're using the liquid or you're using the bar, it's a soap, and so if you have a tendency to dry skin, it's going to make you feel tight and dry. Okay, so really, one of the things that you're interested in is you're interested in prevention.
Yes,
and that's a good place to start, and then I'll get into kind of the dry skin. And by the way, let me ask you where you think you have pigmentation.
I have it like right here.
Okay. So kind of across the cheekbones.
And I used to kind of have melasma on my upper lip a little bit, but it's going away now.
Okay.
Yeah.
Okay. So prevention is a really good place to start. And most of the damage that you're going to see in your lifetime, most of what you think is inevitable aging, happened before the age of 10.
Right.
And it takes a long time to show up. And pretty much... at least by the age of 20, 50% of it is programmed into your skin. So when you're 30 or you're 35 and you start seeing these things that you think are inevitable, what you're really seeing is you're seeing this damage that took you years to show up. And once it starts showing up, it is a sort of a cascading effect. It gains momentum and it just keeps going and it gets a little worse. So what we can do, one of the things we want to talk about is like we can't change what you did years ago, but there are topical agents that can really make a difference in how that looks. And also there's things that we can do that are preventative as well. With regard to the dryness, and I want to talk about that for just a moment. So when we touch the outside of our skin, that's the stratum corneum. It's a dead layer. You shed about 500 million cells a day, but you don't really realize it because they're microscopic, but we're shedding cells all of the time. And it's a dead, dry layer. So what happens is that when you wash your face and when that layer builds up, and it builds up more as you get older, it hardens and it cornifies. And it feels tight and dry. Maybe when you first wash your face or you wet your face, it wets it down. And so it kind of, in a sense, lubricates it or makes it sort of not stretch a little bit. But as soon as your skin dries, it's tight and dry. So one of the things that we want to do is we actually want to do things to get rid of that dead layer. Because when you just rinse your face, what you're doing is that dead layer is sitting there, and as it kind of hardens and cornifies, it also builds up around follicle openings. It can make the follicles look larger. It can also make your skin look duller. It can also make the skin even sometimes look a little bit exacerbate the appearance of fine lines and wrinkles. And so generally when you see somebody that has very glowing, very even toned, luminescent skin, their stratum corneum is actually very thin. Now, a lot of times people say to me, oh my gosh, Jan, if I use glycolic acid and I use retinol and I use all of these things, aren't I going to thin my skin? And I have a sarcastic answer. I say, well, I hope so, because what you want is you want a very thin, compact stratum corneum. Think of a baby skin. Think of somebody who's 10 years old and their skin has just got that luminescent, really very refined, glowing look. So you want that to be very thin and compact. And actually, it's a better barrier. It holds moisture in better. It's more protective. It functions better. But now your dermis is 80% collagen. You don't want to thin your dermis. You want your dermis to be nice and thick. Because eventually what happens with the aging process and with a lot of sun exposure is that this part of the skin, the outer part, thickens, the dermis thins, and then pretty soon they kind of collapse on each other and it doesn't look very good. So you want a very thick dermis. You want a nice thin stratum corneum. And so that's what we want to do. We don't want to do things to refine and keep that stratum corneum looking really glowing like what you want. And at the same time, though, we want to do things that are going to be protective and also help to thicken up that dermis. Okay, so, and that's really going to give you kind of that overall doiness. Now, the other thing we want to do is we want to address the pigmentation. And the pigmentation issue is something that is, at this point in your life, it's pretty much from sun exposure.
Yeah. And it's funny because, like, my boyfriend and I went to Mexico, and then we've been out, just been outside. And even though I wear sunscreen on my face every day, my freckles, are coming, I always have a little bit on my nose. And I've had them since I was a little kid. But, the ones that are through here and then more are definitely, I was out in the sun the other day, and I, was like, oh, my freckles are definitely out now.
Well, now, have you... the question I want to ask you, sometimes, well, let me back up for a second and talk a little bit about pigmentation. So most people, if they have lots of sun exposure, are going to develop some type of pigmentation. But also, genetically, that is one of the determinations is how much are you going to get? How early in life do you get it? Or also, how easily do you get pigmentation? Because there are some people, if you have more pigment in your skin, they sit in a hot car. And sitting in a hot car, all of a sudden they find themselves pigmenting more. They work if they work in a factory where there's hot ovens, they pigment more. And even a little bit of sun exposure can actually exacerbate that pigment. So that has to do actually with a hormone that's floating around in your body. Now, we pretty much all have the same amount of hormone. You could be a redhead that only burns and never tans, and that person has the same amount of hormone as you, and I probably have the same amount of hormone as you do. If you have more if you're on birth control pills, if you're female, you have more if you're pregnant. But it plays a role in how you're going to react. So lots of times when we work with agents that work with pigment, and they're known as tyrosinase inhibitors, and what they do is they sort of address some of the factors that cause pigment to be thrown off abnormally. Lightening agents, tyrosinase inhibitors, things that help with the appearance of discoloration, and also things like hydroquinone. It doesn't address that issue. So we kind of have to take that into consideration. Right. And that's one of the things that we can look at as well. And it can make a big difference. Okay? So we can get the skin looking much more,
my melasma was from the birth control that I was on. And then I changed birth controls, and then it's slowly gone away.
Okay.
I was like, I am not in it for the mustache.
That can also play a role as well. Some birth control pills can exacerbate it in some individuals more than other birth control pills. It just depends on the balance of the hormones. Okay. So those are some of the things that we're going to kind of address. Now, about your dryness. If you were saying to me, if Claire had said, gee, Jan, I use this cleanser and I use this moisturizer and I use this serum, and then I, put on another product and then I put on sunscreen and my skin still feels dry, then I would probably think, wow, this person really has dry skin. But actually your program is pretty minimal and there's nothing wrong with that, but it just tells me that if you were using a program that had a lot of hydration, that probably I wouldn't put you in a dry category. I would probably put you in a more normal category, and maybe you could have a tendency to be dry, and possibly in the wintertime she might need to modify her program. We're going into the summer, so your skin's probably more comfortable. But I think that by putting you on what we call our normal combo skincare management system, you're going to have a lot of hydration. You're going to feel more hydrated than you have felt in a very, very long time.
When I'm really good about like using all my stuff, my skin definitely feels a lot better.
So what I'm going to do is I'm going to recommend the normal combo system. Now, the big focus for you should be on something called resurfacing. And resurfacing is a term that I use which addresses superficial imperfections. It could be discoloration. It could be people that say, gee, I wish my follicles were smaller. I wish my skin glowed. It could be discoloration. It can be mild to moderate acne. It can be rosacea. All the superficial imperfections that we want our skin to look healthy and glowing and so-called perfect. And resurfacing is typically done with an acid or a combination of acids. And what those acids do is they're multitasking kinds of things. And for example, one of the acids we're going to be working with is something called azelaic acid. It's sold by prescription for rosacea. It's sold by prescription for acne. It's also one of the best things that we've ever seen for fine lines, the appearance of fine lines and wrinkles. And they also use it to help brighten the skin with pigment. But you put these three acids together with glycolic and salicylic, and it's just incredible for resurfacing and just making the skin, like you said, look very smooth, very glowing, very reflective. So in terms of what we want to do now superficially, that's going to be a big focus. There's other topical agents that we're going to be working with that can really make a difference in the appearance of some of the things that Claire is experiencing right now. But we also want to do things that hopefully can prevent some of the damage that you haven't seen yet. Okay,
good.
So that's going to be another focus. Now, the other thing that I'm going to add in your program is this is Marini Luminate. You've heard me talk about this before. So Marini Luminate facial lotion is really kind of the big guns for the pigmentation. And not only does it have lots of tyrosinase inhibitors, and those are ingredients that have the effect of working with active tyrosinase, which goes into the manufacture of pigment, and blocking copper metabolism, so the appearance of the pigment can be much, much, much better. But also, this has retinol in it. And of all the ingredients that have been studied for years in the medical community, let's go back 30 years, 2 ingredients that have the most data of anything, glycolic acid and retinol. Now, you mentioned that the retinol that you used before was irritating. So retinol actually can be more irritating than prescription retinoids. You know, we always hear about prescription retinoids and how long it takes people to acclimate, and sometimes they stop using them because they start peeling and they look red, and it gets very discouraging. But Dr. Klickman, who invented Retin-A, he actually wrote a lot about retinol. He actually said retinol was more bioavailable. Retinol actually worked better. But the thing is that retinol, if you use it in a percentage that is equal to a prescription retinoid, it is actually much more aggressive. So typically you see most products in the marketplace in very, very small percentages of retinol, because while you can get a fairly nice effect, you don't get some of the irritation, but you're not going to get the effect that you would get with like a prescription retinoid. So from a chemical standpoint, this is how it works. If you had the highest strength of a prescription retinoid, which is 1/10 of 1% or 0.01, I believe, to get my math right, you would need 10 times more retinol to equal that. And the way that retinol works is you have an enzyme in your skin, we all have it, and when it comes in contact with your skin, it turns into retinoic acid or tretinoin, the active ingredient in a prescription product, but you need 10 times more. Now, if you had 10 times more and you were trying to equal the 1% or the 1/10 of 1%, you'd need 1% of retinol. And let me tell you, it is unbelievably harsh. Well, our claim to fame is that in our studies, we actually had the full 1% of retinol. And in the clinical study, this is a dermatologist study, 76% of patients had no side effects, no dryness, no side effects. 24% had maybe very mild dryness or very mild, a little bit superficial peeling, which was easily handled with frequency. So this not only has this ability to really have an effect on the appearance of the pigment, but it also has a substantial effect in terms of appearance of aging. In addition, this has got something in there that's going to help out with that whole other issue that we talked about in terms of, kind of genetically how we handle the sun, as well as it has turmeric. Now, turmeric is a really, really powerful tyrosinase inhibitor. It's very powerful on pigment. It's also very anti-aging. So
Great.
for the
I put in my
appearance of
coffee
aging.
every morning. I'm on the right track.
Okay, good. Well, so for centuries in India, they put turmeric on the skin, and even after a few days of wearing turmeric, their skin is actually lighter and brighter. But the problem is that while they're wearing it, they're bright yellow.
Right.
So, she laughs. But so, people have taken the root of it, and they've taken sort of the weaker components of it for products, but they just don't have the same effect. And we've actually been able to take the active chemical and make it colorless. So this is going to be something that's going to be really, 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 really powerful for your skin. Now, the other thing that I'm going to recommend for you, probably a couple of other things that I'm going to recommend for you for the future. And one is going to be our Hyla 3D, and the other one is going to be something called Cleanzyme and Skinzyme, which is a proteolytic enzyme that digests dead or diseased tissue without hurting normal living tissue. And so it's like an exfoliator, but it can't hurt your skin, but it leaves it looking like glass. So we'll kind of look at that for the future. And what I'm going to be doing is I am going to be checking back with you, because we want to make certain that everything is working well, and in case we need to modify something. And as time goes on, generally you do modify things, not because the product is not because it's irritating or because it's not working well, but because seasons change, lifestyle changes, people get older. So we're going to check back with you. And the other thing that I always tell people is, even if you tell me a month or 2 months from now, Jan, my skin is the best it's ever been, I can get it even better. Okay? Do you have any questions for me?
No, not off the top of my head.
Okay, great. Well, I'm excited to see how you do. I can't wait.
I'm excited.
So thank you for watching. Please subscribe, and I'll see you next time. Bye.